This presentation is about nursing and the special needs child. I will be telling the story of my son Ian and the nurses who cared for him throughout his life. Our story begins much like most stories. My husband Brian and I met, got married, and found out we were pregnant with our first child. Around 20 weeks, I began experiencing preterm labor and was hospitalized until Ian was born at 20 weeks gestation. Ian was immediately taken to the NICU, where his first experience with nurses began. He weighed 1.5 pounds and was 12 inches long. Ian was critically ill from the moment he was born. Ian was intubated shortly after birth, and the nurses began full-time care of him. The NICU nurses helped us by teaching us about each condition that Ian had, the treatment and testing he would require, and helping us to perform normal parenting skills such as changing a diaper. This can be very complicated when your child is on a ventilator and in an isolette. Ian experienced most of the complications that are frequently seen in preemies. He required emergency surgery for inguinal hernias before he weighed 2 pounds. After several weeks in the NICU, it became apparent that Ian had a very serious condition. Our son Ian had periventricular leukomalacia, otherwise known as PVL. PVL is a result of swelling in the brain that puts pressure on the brain matter surrounding the ventricles. When the pressure finally resolves, the tissue has been irreversibly damaged, resulting in enlarged ventricles and severe neurological issues. The resulting condition is severe quadriplegic cerebral palsy. After 4 months, Ian was discharged to come home, but we soon realized that this did not mean the end of nursing for Ian. It was just the beginning. After his discharge, Ian required frequent monitoring. He began to exhibit severe reflux and failure to thrive. He failed to gain weight, and it was soon determined that he needed an NG tube for supplemental feedings. Ian started receiving nursing care at home when he required NG feedings. The nurses fed him, provided medication and daily care, and taught me how to check placement of the tube, among many other things. After many tests, Ian was diagnosed with reflux and failure to thrive, and had a Nissen fundoplication with G-tube placement. The Nissen fundoplication is a surgical procedure to treat reflux where the upper part of the stomach is wrapped around the lower esophagus, reinforcing the lower esophageal sphincter. This prevents the reflux of gastric acid and stomach contents. Ian attended a feeding clinic at Children's Hospital, and after 2 years, the doctors told us that it would be better not to feed him due to dysphagia and risk of aspiration. You can't even imagine how difficult it is to know that your child will never eat. Ian's developmental delays became more apparent the older he got. When he was about 1 year old, his developmental specialist at DuPont told us that the PVL had caused extensive brain damage and that Ian would have severe cerebral palsy with cognitive delays. Cerebral palsy, or CP, is a general term used to describe movement disorders that result from some form of brain damage before the age of 2. Ian's type was a very severe form of spastic CP. Spasticity is increased muscle tone that makes the limb stiff and can result in contracture and inability to use the limb effectively. Ian's disability left him unable to walk, talk, eat, or speak, but he sure could smile. Ian had also suffered from cortical blindness, where the eye is unaffected but the brain has trouble interpreting the signal, resulting in a picture that is similar to Swiss cheese. There is no cure for CP. Treatment is aimed at preventing complications and maximizing the child's potential. When Ian was 6 years old, he had an intrathecal baclofen pump surgically implanted to reduce his spasticity. This infusion system consists of a small, disc-shaped pump and an intrathecal catheter that is placed in the spinal column. The baclofen pump delivers medication directly to the spine to minimize severe spasms. The pump allowed Ian to sit comfortably, to sleep on his back for the first time, and to reduce the incidence of contracture. Nursing considerations for the pump include monitoring for overdose or withdrawal in case that the catheter were to become blocked. When Ian was 12, he needed a full spinal fusion with rod placement for a 90-degree curve in his spine. Rapid growth combined with the tight muscles of cerebral palsy often causes scoliosis. By the time Ian's curve was found, it was compromising his breathing and compressing his intestines. This surgery was very involved and required a long recuperation time. After this, and Ian's 25 other surgeries, Ian's nurses provided his post-op care at home. Ian had physical, occupational, and speech therapy on a regular basis, and his nurses did range of motion exercises with him throughout the day. Ian wore braces called MAFOs on his legs and hand splints. Ian's nurses needed to be able to use all of his equipment. He required a wheelchair, a shower chair, a changing table, a stander to improve bone density by bearing weight, a hospital bed to reduce aspiration risk, improve his breathing, and to help him position with his contractures. He also had a special pressure-reducing mattress. Ian often required suctioning as he was unable to cough effectively. Special consideration was needed to prevent pressure sores. He had a portable and a home feeding pump, an oxygen concentrator, and a BiPAP machine. And just like with any patient that is unable to move, it was important to change Ian's position often. He had several areas that were always in some stage of redness or breakdown. As Ian grew larger, a lift was also needed to safely lift Ian and prevent injury to both him and the nurses. Ian was unable to speak, but had many nonverbal ways to communicate. He used a switch to operate a communication device, his computer, and several toys. He could understand what was said to him and indicate choices by touching, smiling, or looking at an object. When care is provided in the home, there are special considerations to take into account. The nurse is alone in caring for the child much of the time and needs to be knowledgeable about the condition and complications that can arise. Nurses can help assist the family in learning to care for and cope with the child's disability. Our nurses enabled us to have a more normal way of life. We included Ian in most activities that we could, and the nurse often went along with us so that we could participate without having to worry about the medical care. It was important to me that our other children were involved with Ian as well, and didn't feel neglected or as if Ian was something to be feared. My nurses were great about including his brother and sister in activities like a walk around the block, fishing in our pond, picking flowers for Mom, or blowing bubbles. In April of 2007, I was diagnosed with a serious bone infection. I was unable to walk, bend, or lift, let alone care for my son. I had a PICC line surgically implanted and started IV therapy at home. I was so thankful for his nurses. I could still see him and love him up even if I couldn't care for him. On June 29th, tragedy struck our family. My son Ian died. My son's nurse Debbie supported me while he died in my arms. When we got to the hospital, she reminded me to start my own IV therapy. She had brought extra clothes and helped me bathe him one last time. I have no idea how she kept her composure while the patient she had cared for all of his 14 years died. Ian's nurses came to his funeral and spoke as a group. It meant so much to me to see how they cared for him and that he had touched them as well. They are still a part of our family. My personal nursing motto is that I will treat every patient as if they were my son.